Antibiotics are among the greatest medical discoveries. They save millions of lives every year by fighting deadly infections. But here's the truth many people don't know. Not all antibiotics are equally safe. Some of them can cause serious, even permanent damage. In today's video, we'll explore the antibiotic group that is considered one of the most dangerous worldwide. We'll talk about its uses, common and rare side effects, why doctors are cautious about it, and what safer alternatives exist. If you're someone you know has ever been prescribed antibiotics, this information could be life-changing. Antibiotics are medicines designed to kill or slow down the growth of bacteria. When used correctly, they save lives from infections like pneumonia, urinary tract infections, or skin infections. But while they are powerful weapons against bacteria, they can also harm the body if misused. The challenge is to balance their benefits with their risks. Some antibiotics have only mild side effects, while others carry black box warnings from health agencies. And the one we are focusing on today falls into the second category. The group we are talking about is called fluoroquinolones. You may recognize some of their brand names. Ciprofloxacin, C-Cipro, levofloxacin, Levaquin, and moxifloxacin, Avelox. These medicines are often prescribed for urinary tract infections, respiratory infections, skin infections, and sometimes even for stomach or bone infections. Fluoroquinolones are highly effective, which is why they were once very popular. But over time, doctors and patients started noticing something alarming. These antibiotics were causing side effects that were not only severe but sometimes permanent. Like most antibiotics, fluoroquinolones can cause some everyday problems. People often report stomach upset, nausea, diarrhea, headaches, or dizziness. Skin rashes and sensitivity to sunlight are also common. For most patients, these effects are temporary and go away once the medicine is stopped. But what makes this antibiotic class different is the risk of serious, long-lasting harm. This is where fluoroquinolones stand out as one of the most dangerous antibiotics. Let's break down the major risks. Tendon damage. Fluoroquinolones are strongly linked to tendon injuries, especially the Achilles tendon. Patients have reported sudden ruptures even while walking or doing light exercise. Recovery can take months, and in some cases, mobility is never the same again. Nerve damage, peripheral neuropathy. Some patients develop burning sensations, tingling, numbness, or weakness in their arms and legs. What's worse, these nerve problems can last for years, even after stopping the medicine. Brain and mental health effects. Anxiety, confusion, depression, and even hallucinations have been reported. Imagine taking an antibiotic for a simple infection and then struggling with mental health issues that linger. Heart rhythm problems. Certain fluoroquinolones can disturb the electrical activity of the heart, leading to arrhythmias. For people with existing heart disease, this can be life-threatening. Long-term disability. In rare cases, people have reported a cluster of disabling side effects, including pain, fatigue, and neurological problems that make normal life difficult. Because of these risks, many health agencies around the world now warn against using fluoroquinolones unless absolutely necessary. Scientists believe fluoroquinolones interfere with the body in unique ways. They can weaken collagen, the protein that holds tendons and connective tissues together. They also damage mitochondria, the energy centers of our cells, which explains the muscle pain and fatigue. And they may irritate nerve pathways, leading to neurological issues. This is why doctors are cautious. Compared to antibiotics like amoxicillin, fluoroquinolones carry far greater risks. The dangers of fluoroquinolones are not just theories. Health authorities worldwide have issued strong warnings. The US FDA, Food and Drug Administration, has placed black box warnings fluoroquinolones, highlighting risks of tendon rupture, nerve damage, and mental health effects. The European Medicines Agency, EMA, has restricted their use and advised doctors to avoid prescribing them for mild infections. Other countries have followed similar guidelines, urging healthcare professionals to prescribe these drugs only when no safer alternatives are available. The good news is that for most common infections, safer antibiotics exist. For example, amoxicillin for respiratory and ear infections, doxycycline for skin and chest infections, azithromycin or other macrolides for pneumonia or throat infections. These medicines also have side effects, but the risks are far lower compared to fluoroquinolones. So what should you do if your doctor prescribes an antibiotic? Never self-medicate. Taking leftover antibiotics or buying them without a prescription is dangerous. Ask questions. If your doctor suggests a fluoroquinolone, ask if safer options are available. Listen to your body. If you notice unusual pain, tingling, weakness, or mood changes while on antibiotics, contact your doctor immediately. Don't stop suddenly without advice, but do seek urgent medical help if symptoms are severe. Remember, being informed is the best way to protect yourself. Fluoroquinolones are powerful, and in life-threatening infections, they can save lives. But for everyday infections, their risks often outweigh their benefits. That is why health authorities and experienced doctors now recommend using them only as a last resort. If you found this video helpful, please share it with others. Someone you know might be taking or considering these medicines, and your share could save them from harm. Don't forget to subscribe for more easy-to-understand health content. Stay safe, stay informed, and see you in the next video.